Hello, I'm Jan Leifman.
And I'm Shivika Kannan.
Welcome to MedNews Week Conference, where we feature presentations by medicine's global leaders Today we have an amazing keynote speaker in Dr. Amy Comander. Dr. Comander is the Director of Breast Oncology and Survivorship at Mass General Cancer Center in Waltham at Newton Wellesley, and also the Director of Lifestyle Medicine at Mass General Cancer Center.
In today's presentation, Dr. Comander discusses lifestyle and the tools to optimize health and the well-being in oncology care.
Did you know that Dr. Comander also established the Mass General Cancer Center at Newton Wellesley Multidisciplinary Breast Oncology Clinic? She also developed Paving the Path to Wellness program, a 12-week lifestyle medicine-based wellness program for breast cancer survivors, and also organized a 3-part cancer survivorship series for Mass General Cancer Center at Newton Wellesley Hospital, Thriving After Cancer, Strategies and State of Mind.
She is truly an accomplished pioneer in the field of lifestyle medicine.
So let's tune in and learn from this global leader.
So the title of today's talk is Lifestyle Medicine, Tools to Optimize Health and Well-Being in Oncology Care. And this is an area of great interest to me, and I'm excited to share this with you today. As we think about our goals for the new year and how we can provide the best care for our patients with cancer, an important question comes to mind. How can we also optimize the health, well-being, and of course, the outcome for our patients using our treatments that are conventional and very important, as well as other treatments to improve their lifestyle. And that's what we're going to talk about today. I've outlined the objectives of my talk here. First, we will focus on the importance of survivorship care for individuals with a cancer diagnosis, with an emphasis on the need for health promotion. Then we will discuss the role of the 6 pillars of lifestyle medicine and their relevance to oncology care. And finally, I will review some models for integrating lifestyle medicine into oncology care and how all of you can learn more about the field of lifestyle medicine. And I look forward to answering questions and having a discussion at the end. I think it's important to start off this conversation with a focus on how do we actually define cancer survivorship. And this is a definition taken from the National Cancer Institute. And I would just like to highlight that in cancer, survivorship focuses on the health and well-being of a person with cancer from the time of diagnosis until the end of life. And this includes the physical, mental, emotional, social, and financial effects of cancer through that time period. In addition, the survivorship experience does include issues related to follow-up care, including regular health and wellness checkups, assessing for the late effects of cancer treatment, cancer recurrence, second cancers, and quality of life. So I think it's really important that we all have an understanding of what we mean by cancer survivorship during this talk. The Institute of Medicine published this really interesting document back in 2005. So now it was many years ago, but it was really interesting because this document focuses the attention on cancer survivorship and the challenges of transitioning our cancer patients from that intensive initial time of treatment to a period of time where they're having less frequent follow-up by oncology and more collaboration with primary care. And the report really does highlight the lack of consistency in who is responsible for our patients in addressing their physical and emotional needs after completion of primary treatment. While this was published back in 2005, I think many of us can agree that we still face challenges in providing appropriate survivorship care, even in 2023. And collaboration between oncology, primary care, and other specialties is really key. It's a really interesting report, and certainly I'm not going to have time to go through the whole thing, but I really wanted to focus on a few interesting aspects from the beginning of the report and really highlighting that the transition from active treatment of cancer to that post-treatment phase is critical for long-term health. And if the care is not planned and coordinated, cancer survivors are really left without knowledge of their heightened risks and a follow-up plan of action. Therefore, it's really essential that there is a great plan created in order to help these individuals promote a healthy lifestyle, of course, check for cancer recurrence, and manage the lasting effects of their cancer treatment. This slide really illustrates the various phases of cancer survivorship. We know that we're treating patients in our clinic in all of these different phases. Maybe they have an early stage cancer where our goal is to treat them with curative intent. Maybe they unfortunately do have advanced cancer, or they have recurrent cancer that is now metastatic. And certainly our goals are really to prolong life. But thankfully, due to the incredible advances we're seeing in treatment, many of our patients are living for many years with advanced cancer. And that's actually led to new terms we use, such as metavivor. And then finally, there are patients who have progressed to end-stage disease. And there, our goal is really to provide the best possible quality of life. But as we'll discuss, these tools from lifestyle medicine are very relevant to this population as well. In the United States, it's pretty amazing to reflect on the fact that there's currently 18.1 million cancer survivors living in this country. And what's also important to reflect on is over the next 9 years, that population is expected to increase by about 24% to 22.5 million cancer survivors. So this is a large number of individuals who have been through various types of cancer treatment, who are going to have all kinds of health needs that we need to address. And also we need to help prevent further chronic diseases. We want to cure their cancer, but prevent further complications. Just to put this in perspective, again, this is data from 2022, looking at the estimated causes of cancer and deaths from cancer in the United States. The top panel is focusing on new cases. The bottom panel is looking at estimated deaths. And many of us are familiar with this information, but certainly for women, the most common cancer diagnoses are breast, followed by lung and colorectal. And then for men, that would be prostate, followed by lung and colorectal. And then in the bottom panel, looking at the most common causes of deaths, we know that lung cancer is the most common cause of cancer-related death for both men and women. And then for women, that's followed by breast and colorectal. And for men, that's prostate and colorectal. The next slide, though, illustrates the breakdown for cancer survivors in the United States. And the top panel is looking at figures estimated for 2019, and the bottom panel is by 2030. And as you can see, we have a growing population of cancer survivors. And in fact, as I noted, by 2030, that number may approach 22,000. Again, for women, breast cancer, uterine cancer, thyroid cancer survivors, and for male cancer patients, we're thinking about survivors of prostate cancer, colorectal, or melanoma. So these individuals are all going to have very unique needs. As illustrated here, we know that our cancer treatments have various kinds of side effects that can have both short-term and late side effects. And we think about the side effects of surgery, chemotherapy, radiation therapy, hormonal therapy, targeted therapies, immunotherapy, and of course, non-treatment related specific side effects. We also think about an individual's quality of life and all of the aspects that contribute to that. Certainly that incorporates physical well-being, social well-being, spiritual well-being, and psychological well-being. And as we'll talk about later in this talk, lifestyle medicine certainly is relevant to all aspects of an individual's well-being and quality of life. Survivorship care comprises numerous elements, which are illustrated here. And I know many of you are familiar with the bullet points on this slide. I would like to highlight that a key component of survivorship care is assessing and managing physical, long-term, and late side effects of cancer treatment, attention to psychosocial issues, but also promotion of healthy behaviors. And I put that in bold since that's really going to be the focus of the remainder of my talk. I'm a breast oncologist, so of course I'm going to first highlight the key guidelines from the American Cancer Society and American Society for Clinical Oncology as it relates to health promotion for breast cancer survivors. And these are really essentially 4 points that we need to think about when we're seeing our patients with breast cancer in clinic. It's very important that these individuals are counseled to achieve and maintain a healthy weight. We talk about nutrition and a focus on a dietary pattern that's high in alcohol. We talk about the importance of physical activity and smoking cessation. And I'm going to get into each of these topics in greater detail later in the talk. But these are some of the key points of breast cancer. Why is health promotion so important? And I would argue that it's important not just for the breast cancer patients that I see in my clinic, but for all types of patients with cancer. Now, this slide is actually taken from a New England Journal publication back in 2003, but really demonstrates that unfortunately, obese individuals are at higher risk for developing up to 13 different types of cancer, as illustrated here. In addition to that, individuals with obesity do have increased cancer-specific mortality, especially those with diagnoses of breast, colon, and uterine cancer. Why is this so important? Well, unfortunately, if you look at this slide, which is recent data obtained, demonstrating that since 1960s until the current time, over 40% of individuals in the United States have obesity. And this is very important to recognize. This is a growing problem, certainly in the United States and around the world. And this definitely has implications for the prognosis and treatment approaches we can use for our cancer patients. In addition, it's very important to really understand what are the possible mechanisms that are underlying the relationship between obesity and cancer risk. And this is a very interesting area of research right now. I put a question mark here because I think we don't really understand the true mechanisms, although there are many hypotheses that have been generated. Is the risk related to subclinical chronic inflammation? Is it due to insulin resistance and diabetes? A really interesting area of research. Are there changes in the tumor microenvironment in obese individuals that increase the risk of cancer? Is it the diet itself, like a high-fat diet, that's altering the metabolic microenvironment? Is it due to changes in the gut microbiome? All of these areas are very interesting areas of research that we are really trying to pull together to understand the mechanisms here. Another important point as we're thinking about this theme of health promotion and cancer survivorship is cardiovascular disease risk. And this was taken from a publication just from a few months ago in a cardiology journal that looked at a large population of cancer survivors and the risk of cardiovascular disease. So again, we're trying to cure our patients of cancer, and thankfully, due to advances in treatment, we're doing a much better job at that. However, our patients are at risk for cardiovascular disease. And as you can see, numerous types of cancer are listed on this slide. And these individuals are at heightened risk for cardiovascular disease. And specifically, their risk is driven by an increased risk for heart failure. So this is really important that we pay attention to this risk as we think about how we follow our patients and care for them going forward. Another important paper, again, published a few months ago, looked at the association of daily sitting time and leisure time physical activity with survival among U.S. cancer survivors. Now, we know in the United States over the course of the pandemic, sedentary behavior has increased dramatically due to many of us working from home and just not being as active. Well, this certainly is not good for all of us, but in particular for cancer survivors, this study was one of many that showed that prolonged sitting and lack of physical activity was highly prevalent and also associated with an increased risk of all-cause cancer and non-cancer related mortality risk. So again, another area of health promotion that we need to think about. How are we going to get our patients to be more active? On that note, I would like to move on now to the second objective of my talk. I've really outlined these important areas. Why is survivorship important? Why is health promotion important? What is lifestyle medicine, and how can this field help us address these important issues in cancer survivors? What is lifestyle medicine? So many of you may not be familiar with this field, and I wasn't myself until about 10 years ago. Lifestyle medicine refers to the therapeutic use of evidence-based interventions to treat and prevent lifestyle-related disease in a clinical setting. Lifestyle medicine empowers individuals with the knowledge and life skills to make effective behavior changes that address the underlying causes of disease. So let you take a look at that slide, and then I will explain that there are really 6 areas that we focus on. We call them the 6 pillars of lifestyle medicine that are absolutely key for health promotion, and again, for thinking about how we can prevent chronic disease. And that first one is nutrition, where we really focus on a whole plant-based diet that is full of nutrient-dense foods that are health promoting. We focus on the importance of sleep. We know that more research lately has demonstrated that lack of or poor quality of sleep can lead to many adverse health consequences, including effects on our immune system. Physical activity, we know this is a very key component of health, and it's very important that we find ways to be more active. We focus on substance abuse. We know that addictive substances, whether that's tobacco, alcohol, or other drugs, unfortunately can increase the risk of many cancers as well as heart disease. We talk about stress management and how we can help individuals identify stressors and learn appropriate coping mechanisms. And finally, we talk about the importance of social connectiveness, which is so key for emotional resiliency and overall health. So I'm going to go through these in the course of this talk and illustrate how these are so key for providing the best possible care for our cancer patients and cancer survivor population. Now, how did I get interested in this field? I will tell you, I started at Mass General as a breast oncologist, I guess about 10 years ago. It's hard to believe that it's been that long. And one day in my clinic, I just happened to see this flyer that there's this lifestyle medicine conference sponsored by Harvard Medical School that was being held down the street from where my clinic was located in Cambridge, right near Cambridge. So I was like, wow, this looks really interesting. I'm a runner personally. So I thought, wow, I'd love to learn about how to counsel my patients about exercise, diet, sleep, etc. So I actually went to the conference. I should note that in 2023, it will be available online, so you can watch it from wherever you are in the world. But I went in person, and I was really inspired by what I learned that day about lifestyle medicine and the power of these tools to help our patients initiate and sustain healthy behaviors. And there I met many colleagues who shared these interests, and I was really excited to use these tools and apply them in my cancer clinic, specifically to help my patients with breast cancer. And actually, that's how I got interested in it. And I've really learned more about this field since that time. And I'm so excited to share this with you tonight. So let's just take a step back and think about, as oncologists, what are our attitudes about addressing health behaviors in our clinic? So I will say that ASCO back in 2014, so I guess 9 years ago now, recognized the key association between obesity and cancer risk, as we discussed earlier in this talk, and the adverse outcomes of obesity and cancer risk. And therefore, this survey was designed to really understand oncologists' knowledge about obesity, diet, weight management, and interventions to help patients. And so this survey was actually implemented, I believe, in 2018 and published in 2019. What were the results? Well, in this survey, it was shown that oncologists were quite aware that being overweight or obese affects treatment outcomes in patients with cancer. In addition, as you can see here, 50% were strongly aware that it's important to address a patient's weight in clinic if that individual is overweight or obese. But unfortunately, only 8.7% of oncologists felt that they had adequate training in addressing obesity and energy balance in patients with cancer. And therefore, there was a real recognition that we, as a community of oncologists, really don't feel equipped to address these issues in our patients. Further in the paper, there was another table that looked at the respondents' perceptions of barriers to providing these interventions with patients, to their patients with cancer who are currently overweight or obese. And as you can see on this slide, there are numerous barriers that are identified: lack of time in clinic, patient resistance to behavioral interventions, lack of training or experience about discussing weight issues and behavior change with patients, and unfortunately, lack of available resources for referrals to interventions. So this really struck me when I read this paper, and I realized, as we know, if we focus on the United States, our obesity rates are going up. I just mentioned over 40%. And as oncologists, we have not been well trained in this area. We don't know how to discuss these issues with our patients, and we don't really have great resources to refer them. What are we going to do about this? Okay. I will say that this paper really showed that there are new initiatives needed to support education and training of oncology providers and with regard to providing treatment plans for weight management, physical activity, and nutrition for patients with cancer. So we need to do additional work to understand the patient perspectives as well. What guidance do our patients want around weight, physical activity, and diet? And that's really what the next study was set out to address. This is a patient survey that was also published actually last year. The researchers asked the patients, how often are diet, exercise, and weight management discussed in oncology care? And so it was interesting. The researchers found that in the National Survey of Oncology patients, about half did report attention to these issues during their oncology visits. And those who did have their doctor or a team member address these issues did find that this resulted in positive changes in terms of these behaviors. However, as I mentioned on the previous slide, referral to weight management or physical activity programs or specialists was lower. Why was that? A number of barriers were identified. You'll see a similar theme: lack of education for the oncology providers, lack of time, and just lack of referrals to weight management and physical activity programs because we really don't have enough for oncology patients. So again, these data emphasize the importance that the oncology provider making the recommendation to foster lifestyle change after cancer diagnosis is important to our patients, but also highlights that advice alone is not enough to help with sustainable behavior change. So we need to have dedicated programs that include nutrition, exercise, weight management to ensure that our patients with a history of cancer are able to successfully incorporate their changes as part of their cancer care. So let's get back to these 6 pillars of lifestyle medicine. Now I hope you're seeing why education and understanding about each of these topics is really key to provide the comprehensive care that our patients need. And the remainder of this talk, I'm going to go through these. You can imagine that each of these could be a 1-hour talk in of itself, and I'd be happy to do that in the future. But for the purposes of this evening, I'm going to go through each of these briefly just to highlight why each one is so important. So let's talk with nutrition, one of my favorite ones. And so here I'm sharing some guidelines that are from the World Cancer Research Foundation and American Institute of Cancer Research, as well as the American Cancer Society, focused on some of these key diet guidelines. And the reference is right here on this slide if you'd like to look this up further. Again, what do we think about when we think about nutrition? I like this concept of diet quality. Think about the overall quality of an individual's diet. What does that really mean? Some key concepts: avoiding sugary drinks, limiting alcohol intake, limiting red meats and avoiding processed meats, limiting consumption of energy-dense foods or ultra-processed foods, which we know are very much part of our food supply, certainly in the United States, and really not good for us. And then finally, a focus on eating more fruits, vegetables, whole grains, and legumes. If you picture a plate of food, half of that plate should be fruits and vegetables, a quarter some kind of whole grain, and a quarter some kind of protein source. So that's diet quality. Then there's weight control. Again, this is a tough one, but counseling our patients about achieving a healthy body weight. And then finally, dietary supplements really should be avoided unless specifically recommended for an indication. Another key aspect of this guideline, which was included, was the role of community support. And I think this is a really important component of this guideline because we know that making healthy eating choices is a challenge for all of us. And it's really important to be part of a community that supports your efforts in order to make it easier to, take on a healthy lifestyle, healthy diet, whatever that may be. So there was a really interesting publication, again, a few months ago, published by Doctors Shar and Iyengar and Gemma on Oncology, looking at 2 very popular diets, which we're all familiar with: plant-based diets versus the ketogenic diet. And there's a lot of interest in these diets and how may they be related to cancer risk reduction and which diet may be best for cancer survivors. And this is one really interesting figure from that paper, really illustrating both diets, and in the green, the benefits of the whole food plant-based diet recommended by the American College of Lifestyle Medicine versus the ketogenic diet, which also potentially has some benefits. And then the lavender, that's showing sort of the overlap, the potential benefits of both diets and the mechanism. So I really encourage you to take a look at this paper because they break it down in a beautiful way and explain it very well. And again, on this next slide, I've really kind of highlighted some of the key concepts from their paper that, again, nutrition, we know, a very controversial area, lots of work being done, hard to do these studies for numerous reasons. But we do know that from epidemiologic studies, there's suggestion that there is reduced cancer incidence with a whole food, plant-based diet pattern. Again, getting back to that concept of the diet pattern, diet quality. And we know there's mechanistic evidence to support a plant-based diet, and there are some benefits potentially for the ketogenic diet, including a focus on weight loss, decreased inflammation, decreased insulin levels, etc. In addition, the whole food plant-based diet really provides fiber, which is so important, phytochemicals, increased butyrate levels, decreased IGF-1 levels. So those mechanisms very much support that type of diet. When we think about the ketogenic diet, there is increased beta hydroxybutyrate levels, which may have anti-cancer effects. We know that there are numerous limitations for these nutrition studies. You need to follow patients for a long period of time in order to really see a benefit of a particular diet. And therefore, a lot of work is being done on figuring out novel, innovative trial designs to really help us understand the impact of these diet interventions. So I do really recommend this paper to you if you want to dive into this further. Again, nutrition can be a whole 1-hour topic, but certainly in the interest of time, I wanted to summarize it briefly on this slide. I love this quote from Michael Pollan, who wrote the book Food Rules and many other interesting books. Eat food, not too much, mostly plants. Just focus on that. I mentioned earlier how I like to think of a healthy plate. This is the Harvard Healthy Eating Plate on the left here, illustrating how half of the plate is comprised of fruits and vegetables. You have your whole grains and a healthy protein source. In the middle panel, this is another depiction of a whole food plant-based plate from the American College of Lifestyle Medicine website, illustrating a similar theme. And then finally, I do highly recommend resources on the AICR website, which provides many evidence-based tips for nutrition, both for cancer risk reduction and for survivors. Moving on. Exercise. Okay, so this is the second pillar I'd like to focus on. Again, we could spend an hour talking about exercise and all the really interesting ways that exercise may lower risk of cancer and improve health and outcome for our cancer survivor population. I will highlight that, again, last year, ASCO came out with an updated guideline focused on exercise, diet, and weight management. And the exercise recommendation was actually quite strong. And I feel like all of us really need to be aware of this and think about how are we actually going to implement this in our clinic. So the highlight is right here. Oncology providers should recommend aerobic and resistance exercise during active treatment with curative intent to mitigate the side effects of cancer treatment. So there is good data supporting this statement. In addition, there is good data supporting the fact that exercise interventions during active treatment can reduce fatigue, preserve cardiorespiratory fitness, physical functioning and strength, improve quality of life, and reduce anxiety and depression in some populations. And there's a low risk of adverse events. Again, this is a really excellent guideline. I would read it in its entirety, but the strongest recommendation is really regarding the role of exercise. Where can you find more information about exercise and what you can recommend for your patients? The American College of Sports Medicine is a great place to start. And actually, there's a specific part of their website called the Moving Through Cancer Initiative, which has specific figures like this one. I just wanted to share one, really illustrating the benefits of physical activity for individuals with cancer. This is just, again, this particular figure is showing many of the issues our patients face. Again, cancer-related fatigue, limited physical functioning, mood changes, lymphedema, bone loss, etc., and what the recommendations are in terms of exercise. In general, what I recommend my patients is 150 minutes of moderate aerobic activity each week. That can be broken up throughout the week, 30 minutes, 5 times a week. That could be 10 minutes, 3 times a day. It can be broken up however it best works for that individual. And strength training is also very important, usually 2 sessions a week. And these interventions, are very hard for many patients to adopt, and many patients are starting from a place where maybe they haven't been active, or maybe they've really had a hard time during their treatment, and it's hard for them to even imagine becoming more active. But more and more data is illustrating the benefits of physical activity for our patients. And again, it's in the ASCO guideline now. So a really interesting area, again, we could talk about this for an hour, is what are the mechanisms by which exercise is providing these benefits to our patients with cancer? Because there's also data, for example, in breast cancer, colon cancer, prostate cancer, showing that physical activity is also associated with a lower risk of recurrence and improved outcome for our patients. So how is that happening? What are the mechanisms? And so there's a lot of research being done in this area. Many indirect mechanisms have been hypothesized. Is there decreased expression of oncogenes, reduction of hormones that are circulating? Are we also just seeing this benefit due to the fact that we're combating metabolic conditions such as adiposity, chronic inflammation, insulin resistance? So there's many really interesting papers you can read about this. But one area that I find really interesting is this concept of myokines. So if you look at the top panel here, this cute little mouse running on this, I guess, hamster wheel or treadmill for the mouse, his muscles are contracting, and that releases these substances called myokines, which can then cause the release of interleukin-6, oncostatin M, spark, and other molecules that have anti-cancer properties that can lead to apoptosis of cancer cells and essentially lead to cell death and reduction in tumor growth. And this is taken from a New England Journal paper from a few years ago, which really explained this particular mechanism really well. And it's very interesting. And I know this is now being studied in various types of cancer, this concept of the myokines and their benefits. So again, another area that we also look into further so we can best understand this mechanism and explain it to our patients. There's a lot of interest, again, about exercise and what is the optimal timing for the introduction of physical activity. And again, just sharing an interesting paper from a cardiology journal just published a few months ago. This study was done in the Netherlands and took patients with breast cancer and testicular cancer and randomized them to an exercise intervention, which was 12 weeks. And half of the individuals embarked on the exercise regimen during chemo, and half of them started it after chemo. So there was two groups. There was not a control group that did not exercise, but there were two groups that just had exercise introduced at a different time point. And the researchers were really interested in looking at various outcome measures, which are outlined below: peak oxygen max, quality of life, muscle strength, et cetera. And what was really interesting, if you look at this panel here, again, group A are the individuals, that's in blue, who did the exercise during chemo. Group B was after chemo. And these various panels are looking at the different parameters that they were studying. Bottom line is at a year, so this is the 12 months, you can see that the blue lines and the red lines are basically on top of each other. So, the patients were all essentially in the same place in terms of peak oxygen uptake, health-related quality of life, and fatigue. But those individuals who did start the exercise program during chemo, as you can see here, these group A patients, they did derive benefits in terms of improved peak oxygen uptake, health-related quality of life, and fatigue earlier on, since they were really encouraged to exercise earlier on. So the concept I wanted to convey is that our patients can exercise during treatment. This was a supervised program, of course, and it did provide significant benefit. But for those who did start later, they also derived benefit. Just more food for thought regarding timing for physical activity. Moving on, the third pillar, and I wanted to talk about sleep. We know sleep disturbance and insomnia are highly prevalent among cancer survivors, with rates as high as 30 to 50%. We all know there's multiple factors that can contribute to insomnia. Was it side effects of treatment, discomfort from local therapy? And we know a top one, unfortunately, is anxiety and fear of cancer recurrence. We know that cancer-related insomnia is associated with worsening daytime functioning and impairment in quality of life. There are numerous treatment options that we may consider: psychosocial interventions, pharmacologic therapies, and behavioral treatments such as cognitive behavioral therapy for insomnia and mind-body programs. This is a really important area to focus on. And I'm fortunate one of my colleagues at MGH, Dr. Daniel Hall, is doing a lot of research on CBTI, which means cognitive behavioral therapy for insomnia, particularly in cancer survivors. So this is an area that I hope will have more tools to offer our patients soon, since I would say in my clinic, I'm often talking about sleep disturbance and how we can improve this for our patients. Again, the fourth pillar, and I'm sorry to go through these quickly, but just in the interest of time, stress management is also way up there for our patients. We know that the National Comprehensive Cancer Network has included screening tools to measure distress in our patients. And in fact, we're encouraged to assess this for each patient at every visit using this kind of distress thermometer. And it's really important that we inquire to our patients about this issue and offer them counseling and referral to appropriate services as needed. This chart was taken from a great review in the New England Journal published a few years ago by Dr. Shapiro, looking at not only stress, but other psychosocial issues faced by cancer survivors. And those of us who care for our cancer patients know that these issues are highly prevalent: depression, anxiety, post-traumatic stress disorder, fear of recurrence, and of course, concerns about returning to work and fears about that. So these are very common. Certainly, there are many pharmacologic interventions that we can use, but there are also many other interventions that can be helpful, such as cognitive behavioral therapy, stress reduction tools, etc. So there's really a need to assess for these problems and figure out best ways to address them in our patient population. Moving on to the next pillar, we know that substance use is an important topic to address in our cancer patient, particularly alcohol, and that's what I thought I'd focus on this slide. We know that consumption of all types of alcohol, unfortunately, can increase the risk for cancer, and therefore alcohol consumption really needs to be limited. In fact, the World Cancer Research Foundation and AICR and American Cancer Society conclude it's best not to drink alcohol. On this slide, I've illustrated a number of mechanisms of alcohol as it relates to cancer risk, whether it's direct damage to DNA, decreased breakdown of estrogen, impairment in nutrient absorption, or contributing to weight gain. So again, it's very important that we counsel our patients about avoiding excessive use of alcohol or use of alcohol, period. Finally, getting to one of my favorite pillars of lifestyle medicine, social connection. So instead of showing you a lot of data, I thought I'd just tell you more of a story based on a program that I started at our cancer center, and I'm excited to tell you a little bit more about it. So we all know that social connection is one of the key pillars of lifestyle medicine, or you're learning it today. And we all know the importance of social support and finding community. And what I realized when I started caring for patients with breast cancer at MGH is that our patients really needed community, and there were really not a lot of ways to access that, even in the great city of Boston. And so this is a program that I started. This picture, by the way, was taken in 2019, actually January 2020, now that I think about it. So pre-COVID, but this quote from one of our participants really highlights the key benefit of our community. The paving program has been so important to me because it connected me to others who have gone through cancer treatment. My paving pals immediately understand what I'm talking about when I express a concern or fear. In fact, these are the only people I can talk to openly about breast cancer, and that's been invaluable in helping me move forward in my life. Cancer will always be part of my life, but I want to keep it in perspective, and paving and my paving pals have helped me do just that. So I'd love to tell you a little bit more about this program, how we built community, and how we've incorporated lessons from lifestyle medicine into this program. So this is just a slide. One of the groups I led, they call themselves the Pink Ladies. As you can see, we were all wearing our fun pink shirts for a 5K that we did together. And this group is very bonded and very supportive of each other. So what is the paving program? So when I went to that lifestyle medicine conference sponsored by Harvard Medical School, again, about 10 years ago, I was fortunate to meet Dr. Beth Frades, who's currently the president of the American College of Lifestyle Medicine. And I met with her and I told her, I want to start an exercise and weight loss program for breast cancer survivors. And she was like, whoa. And then she really, you remember, I hadn't had much education about these topics in medical school or residency or fellowship, or as a junior attending. So she kind of helped me understand that there are many components that have to be addressed in order to address these issues for our patients. And that's really where lifestyle medicine comes in. And she had developed a similar program for stroke survivors. So I began a collaboration with her to adapt her paving program for stroke survivors specifically to a breast cancer survivor population. So again, the goal of this program is to provide education about evidence-based tools from lifestyle medicine in order to promote health, well-being, and ultimately improve outcome for patients after they've completed initial treatment for breast cancer. And it's a weekly program over 12 weeks, which is really focused on this educational component. And I will say that the amazing social connection piece just formed along the way. And that was not an initial goal when I started this program, but I'm really happy to see that it was a wonderful benefit. Initially, I did this program in person, but of course, over the course of the pandemic, it has transitioned to a virtual format. And these are the various topics that we cover in the paving program. You know, it's a mnemonic, so physical activity, attitude, variety, investigations, nutrition, goal setting, stress management, timeouts, energy, purpose, sleep, and social connection. So these are all woven in throughout the program. We actually published a workbook in 2021, which is shown here. And I will say that all profits from this book go to an organization we started, which is a nonprofit, since we're hoping to extend the benefits of this program to others. We have really built community through this program. I should say this is a team effort, as I'll show you later on. I have a wonderful team that works with me to develop this program and our newsletters that go out with the goal to build community among the participants. This is a 5K we held, I think this was, June, on National Cancer Survivor Day, which was June 6th. And as you can see, we were still being very COVID cautious, so we encouraged people to be outside, but you know, some folks did choose to meet up and be together, and they sent us their pictures. And it's really wonderful how we've built this community and fundraised for this program, which is completely supported by philanthropy. These are just more quotes from these wonderful participants about how much fun they had getting together, supporting each other, and supporting the paving program, which is so special. I just have to give a shout out to these ladies. They were in my very first group back in the fall of 2019, and they do call themselves the originals because they are the originals. I should note a highlight of my summer was to collaborate with my colleague, Dr. Naomi Ko, who runs the Breast Oncology program at Boston Medical Center, and her amazing nurse practitioner, Nebi. And we offer the program to a group of women at Boston Medical Center. That's a hospital, essentially in a very underserved area of Boston, where they do not have a cancer survivorship program like we do at MGH. And as you can see, these women were very happy and loved the program. And we are really excited to extend this collaboration and do it again next summer and hopefully throughout the year, so we can really broaden the offerings of this program. I have an amazing fourth-year medical student who created a website, and she's really done so much more to help foster community. You've heard enough from me. I'm going to take a break and let you hear it from one of my patients herself.
Hi, I'm Tiffany Hogan. Learning I had cancer was really the worst day of my life. The weeks that followed were bleak. Telling my family and friends, meeting with the doctors, taking medical leave, and just figuring out schedules. I wondered if I'd be around to see my 3 young children grow. Thankfully, I had an amazing medical team and support system. And over the time, as treatment began to work and I met with my therapist, cancer felt like, less of a black hole I'd fallen into, more like a part of me that I learned to accept. But during my treatment plan, I had chemo, then surgery, then more chemo, and then finally ended with radiation. I had downtimes to recover before the next regimen. And during those downtimes, I began to think about how to live life after active cancer treatment. I spent hours Googling. And there were a lot to take in. Should I be on a keto diet? Should I go vegan? How much should I exercise? What type of exercise? Should I take supplements? Which one? How do I reduce stress? It was just overwhelming. And often I flew my hands in the air, feeling exhausted and paralyzed. Thankfully, enter the Paving the Path to Wellness program. 12 weeks of meeting once a week with amazing women affected by breast cancer. Some were in active treatment like me, and some have been out of treatment for months or even years. All were there to learn and support each other. Each week we discuss the science, practical, application of healthy lifestyle choices like nutrition, exercise, sleep, social connections. Slowly I just felt empowered each day. One day I was feeling particularly down and decided to write out the daily changes I've made since the Pathway program. I had made 25 healthy changes. It was really empowering to see that. When I finished radiation, I was leaving the cancer center and I had a very different feeling than I'd had in the past. This time I felt ready to handle whatever was thrown at me. I felt empowered with information and support. You know, I will always have a risk of reoccurrence with triple negative breast cancer, and I really don't have a follow-up regimen like an inhibitor, but I still feel really focused and able to live a happy, healthy life, whatever may come. I'm just so grateful to Dr. Comander and Ms. Haggart and Ms. Abraham and the many guest speakers who generously shared their time and expertise with us. And I'm so thankful to my soul sisters in the program. You know, we've continued to support each other beyond the formal paving group. We meet approximately every other week online, and we all agree that whatever comes our way, we now have the tools to handle it thanks to what we learned in the paving program. I just wish that everyone had this type of support after breast cancer, because that's when the real work seems to begin.
I'm so grateful to Tiffany for making me that video on her iPhone, by the way. But she really attests to the benefits of that social support, the community, what she learned, and just everything she said is just, every time I watch it, it makes me so happy. So that's really why we've developed the program, and we continue to offer it and are excited to broaden it further. And my goal is certainly to help every woman with breast cancer at my hospital, but now at Boston Medical Center and hopefully beyond. So that's something that I'm really excited about, and thankfully having an incredible team that I'm collaborating with. We also have a growing lifestyle medicine program at our cancer center where we have numerous other offerings. We have an individualized clinic where we're able to provide lifestyle medicine consultations to our patients, the paving program, as I just mentioned, and an opportunity for patients to participate in shared medical appointments to dive into these topics further as well in a group setting. Now, let's say you're watching this talk and you're like, well, I didn't really have much education about nutrition, physical activity, how to talk to my patients about behavioral change in medical school or residency or fellowship. How can I learn more? And that's really where the American College of Lifestyle Medicine comes in. And so I wanted to share a little bit about this organization in case you're interested. Certainly, you can Google ACLM and learn more about the organization and the upcoming conference, which will be in October of this year. You're certainly welcome to get in touch with me, either by email or Twitter. And I will say that within ACLM, there is a cancer and lifestyle medicine interest group that meets quarterly. And there you have the opportunity to meet other individuals, oncologists or in other aspects of oncology who are very much interested in learning more about lifestyle medicine and how to offer it to our patients. This is also an exciting thing that just happened literally a month ago. So if you're from New York, your mayor has partnered with the American College of Lifestyle Medicine to offer lifestyle medicine training to every healthcare practitioner in New York City. And that really, means education about the importance of plant-based diets, physical activity, all the pillars of lifestyle medicine that I just outlined. So this is a really exciting initiative, literally hot off the press. And then finally, I just wanted to share a little bit more about ACLM, the organization itself, and the goals of this organization to help individuals become educated about lifestyle medicine as the foundation for health and all healthcare. There is a board certification that you can take, which I did actually in 2020 with some of my extra time. And there are lots of amazing individuals, certainly some from an oncology point of view, but also other aspects of medicine that are really interested in learning more about these principles and how we can help our patients. Finally, I just want to give a shout out to my team. So I mentioned with the paving program, this originated with a collaboration with Dr. Beth Frates, who's now the president of the American College of Lifestyle Medicine. I'd love to give a shout out as well to Dr. Michelle Tollefson, who's an OBGYN in Colorado and women's health expert, and she's been a wonderful collaborator. And then at MGH, I'm fortunate to work with Elizabeth Abraham and Dana Haggett, who are leaders of the paving program along with me, as well as Dr. Stephanie Eisenstadt and our stellar fourth-year Harvard Medical student, Alexis Smith. Hannah is our program manager, and Dr. Naomi Ko and Nebi Stephen are our colleagues at Boston Medical Center who we're currently collaborating with. We also have an incredible team in our lifestyle medicine program. I'm fortunate to work with Lauren Winters, who's a great nurse practitioner who runs the shared medical appointments, along with Carol Sullivan, who's a nutritionist, and these wonderful colleagues, Ashley Dravian, who's a nutritionist, Dr. Shalu Ramchandani, who's an obesity specialist, Dr. Rachel Milstein, who's a psychologist, and Dr. April Hirschberg, psychiatrist, again, Dr. Stephanie Eisenstadt, who's an internist. As you can see, we have a multidisciplinary team, which is really key for offering these programs to our patients. On that note, I want to thank you all for inviting me